Uh, 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 All right, we are live. We are live. Hello, everyone. We're talking about your joints talking to you and what your joints are trying to say to you. That's the topic of our conversation today, Dr. Leviton. And I'm here as always, have conversations to help you live long and well, including, parts of you. So I am delighted. Dr. Panico, this is your third time, right? Is it your
I
third
think
time?
so. I think so. Yeah, second or
Oh,
third.
okay.
Yeah, I'm a veteran guest now.
All right, so Dr. Brittany Panico, she's my friend. She's a colleague. She's an amazing human being. She's also a rheumatologist, over a decade of experience. She is a phenomenal influencer in the rheumatology space, and so we're privileged to have you on tonight, Dr. Panico. Thank you so much for coming.
Thank you. I'm excited to be back.
All right, and she's repeat guest number 3. For those watching, please drop your name in the chat so I can give you a shout out. Even as we go ahead, we're going to answer questions live, and the whole point is to help you address questions surrounding joints. So, Dr. Panico, can you introduce yourself again, what you do, and why you do the things that you do?
So I am Brittany Panico. I am the chief of rheumatology at Summit Rheumatology, and we do have 8 locations. We have several in Arizona, Colorado, Oklahoma, Washington State, and West Virginia, and are growing. So it's really exciting just to be able to serve multiple communities. I went into rheumatology, gosh, thinking about it now, really was my exposure to dermatology and the autoimmune skin things in dermatology. And then the more I started learning about sort of the mysterious autoimmune, conundrums, I really noticed like rheumatologists get to sort of be puzzle masters. We get to put all these pieces of the puzzle together, a lot like primary care, actually. And I love treating patients and seeing their life transform. I love seeing people make progress with goals that they set. And it's just really exciting being able to offer patients, real solutions, real tangible solutions to the way that their body feels and help them understand. I think in healthcare, we're sort of given this message that we're doing harm to our own bodies, right? We're eating bad food, we're not exercising enough, there's all this you should be healthier, right? But what about the people who are doing all the things and they still don't feel good? And so when you have an autoimmune diagnosis or even something like arthritis, where your body starts wearing and showing signs of wear and tear, but you are trying to do the best you can, rheumatology sort of spins that around and is able to say, not always, but sometimes, the past is the past, but here and now we can use medications to hopefully make progress so that the future moving forward is better for you, less pain, less tough stiffness and difficulty moving, and more progress doing the things that you really want to do in life. I think a lot like the message you spread with your patients. And so that's kind of where I'm transforming. I consider myself, I'm not a traditional rheumatologist. I don't really dwell on, all the old stuff. I'm very much like, this is on the market now. This is what the data is telling us. The science is telling us about your immune system. And this is what, studies, clinical trials, and real life experiences telling us about how we get you feeling better. And I think too, I would say a lot of people want to be on less pain medication like opioids, and there's other ways we can treat chronic pain and chronic disease. So it's just really exciting being able to see people's lives transform when you have something, to offer.
So quality of life, quantity and quality of life, using lifestyle, using the themes, and using scientifically proven medications that help. So yes. I like what you do. I love what you do. And so let's dive in. When your joints start talking, Doc, what does that mean? Like your joints talk? Like what does that mean in your world?
So there's a couple different things our joints can say. Sometimes they can be creaky, right? Like if you crack your knuckles, you hear a pop. There's nothing wrong with cracking your knuckles. If it feels good to you, you can do it. It doesn't create arthritis. My 5-year-old learned how to crack his knuckles and he walks around the house and does it. And it just, that noise is really intriguing to us. Same with your neck. Some people like to kind of crack their neck or their back, and it doesn't mean anything bad. It doesn't mean you're going to develop worsening arthritis in that area, but it's just the way the sort of gases settle in our joints and in the fluid that makes like a popping sound. So creaky or crunchy joints, like your knees when you bend or your ankles when you're walking, it's the same sort of phenomenon that happens if you actually like pop a joint, right? Or crack it. So it doesn't mean anything bad. I get a lot of patients coming in saying, well, my ankles and my knees are crunchy. It's totally fine. It may be uncomfortable. That sound may be unsettling and you might feel a little bit of pain or stiffness or discomfort, but the sound itself is not dangerous or doesn't mean anything bad is happening. So that's one kind of sound.
Okay.
The other language that our joints speak has to do with our weather system, the barometric pressure. It has to do with our diet and how much sugar and salt and fluid we have. And so you can be somebody who's very stiff when a storm front is coming in, or you can notice that the weather is starting to change and your joints are a little more stiff and you feel like, oh, it just takes a little bit more time for me to get out of bed in the morning, right? The whole like, I don't want to get out of bed when it's cold. That's true for most people, but happens a little bit more as we age. But it also can happen a little bit more if we have lots of sugar in our diet. If we have diabetes, that is very common. It can happen with certain types of medications, like some of the breast cancer suppression medications cause a lot of joint pain in people. And so there's different reasons that might be the case. But knowing your weather patterns, right, living in an environment where it might be humid versus dry, your joints will definitely tell you what the weather is going to be like. So that's real. That's absolutely real. And that comes from sensors in our body called proprioceptors and baroreceptors. So those are fancy words for basically just our body knows where we are on the planet, meaning are we at high altitude? Are we at sea level? Are we in a dry desert environment? Are we in a humid tropical environment? Without our eyes open, our body will acclimate to that. And one story that really hit home for me that made this make sense is weather patterns based on the Earth's rotation, right? So seasonal patterns, but also the moon. So we are made up of primarily water. Believe it or not, the human body is mostly water. And somebody was saying, the tide changes with the pattern of the moon. So why wouldn't a body that's mostly water, human body, cells that are mostly water, why wouldn't the moon's gravitational pull and energy, gravity, right, affect the way that our body feels? And it was this light bulb moment for me of like, absolutely it does, because we sense gravity in different ways. And the moon, right, we can't see that tug that it has on the Earth, but we know it's there based on the tides changing. And I truly do believe the science that our bodies feel shifts in energy, in electrical conduction, in, this whole grounding phenomenon, right, that we kind of talk about putting bare feet on the ground and sensing the electrical impulses. Like, that's all real. People kind of think it's like woo and voodoo, but there's definitely something to it. So anyways, I went on a little bit of a tangent, but there's the way your body feels based on where you physically are on Earth. And then there's also inflammation. So when our body is really stiff and tight, and it starts getting more difficult to move in ways that should feel normal or were normal weeks or months ago, or you start to notice that daily activities like pulling up a pair of pants, like grabbing and pinching, or putting a shirt over your body, right? Like certain maneuvers are hurting, or gripping your coffee cup or a mug, a glass, a water jug or something that wasn't really bothering you a certain time ago now is hard to do. Like a daily thing is hard to do. Sometimes in women, we notice your hair or makeup pattern might be different because it's hard for you to blow dry your hair, or it's hard for you to style behind you, right? This motion of going behind. Some people start to wear slip-on shoes because they can't tie or they can't get their shoes on because their hips hurt. So wearing like flip-flops in winter to me is always, not in Arizona, but in some of my clinic locations, if people have clothes that don't quite match this season, it's like, tell me what's going on, because you're not really, you're trying to cut corners somewhere, and we need to find out why that might be. So a lot of times when we start changing our behavior because the way our body feels, right? If we equate that to something in primary care where, maybe we're gaining a little bit of weight and we don't want to go shopping or can't go shopping. And so we start wearing layers that kind of cover things up, right? It's like you start doing things a little bit differently because you're trying to manipulate the way that something feels. So when we have inflammation, either from like rheumatoid arthritis or an autoimmune condition like psoriatic arthritis, we start to change the way we do things on a day-to-day basis. And then another kind of inflammation that's really loud is gout. So gout tends to be very painful and red and a lot of swelling, and it's very angry. And so you might not want anything touching you. You might not want to wear shoes. You might not want to sleep with the sheet on. So there's different sort of intensities of inflammation. So things that are very, very inflammatory, you don't want anything around that area. So I would say those are the most common sort of things that we hear, pun intended. We're not listening to the joints specifically in those cases, but that's what your body is kind of telling us as, your healthcare team, like what should we be concerned about in regards to those.
So you mentioned different things. Some, I like the crunching. I used to tell people, stop crunching your like cracking your finger. My husband likes to crack mine. I'm like, why are you doing that?
I don't know.
And I was like, no, don't do that. But there's nothing wrong with it. It doesn't affect. So I will share that message. But you mentioned some things that start to raise red flags. So what are some of the earliest messages our joints actually give us that we often ignore? So we know maybe when to call attention to our physicians or to change habits. What would you say to that, Doc?
Yeah. So anything that's like red and hot is more urgent to call attention to. So we want to make sure you don't have an infection. So if an infection gets in the joint, that can be very dangerous. That can be associated with fevers or feeling sick, or if you have a skin wound that, like a diabetic ulcer or something like that, where it's not healing and it looks infected. So red and hot are alarm bells. And also for gout, gout is really painfully intense. And so the sooner you treat that intense swelling, the better you're going to feel. So, we don't want to like let red swollen joints sort of go on for days and days. Other red flags. So like rheumatoid arthritis is a little bit it kind of creeps up on you, where it's like day-to-day things get a little bit more challenging. But if you notice swelling, right? So all of a sudden your wrist is swollen and it's hard to like move, or again, you're changing your behavior because something is really painful. That's more urgent than just like, I have a kink in my neck because I know I didn't sleep very well, or my back's a little stiff today, or I exercised, right, and my body feels sore. Things like that are uncomfortable, but they're also natural to happen. That's okay. But if it's something where you are like, stop dead in your tracks of like, this really bothers me. I've had patients where they're walking 2 miles a day, and then all of a sudden they're like, my joints hurt so bad, I'm having a hard time getting up off the couch. There's another condition that I haven't mentioned yet called polymyalgia rheumatica, or PMR, that happens sort of mysteriously after we turn 50 is usually when we notice it. But that's really sudden onset, very intense stiffness or pain, usually in the back of the neck, across the shoulders, into the shoulders and the hips and lower back, where it's really hard to reach up. It's hard to like get up out of a chair without really pushing yourself. or people have a hard time getting in and out of bed, in and out of the car. Using the bathroom gets really tricky because, again, that movement of your hips. So if that's associated with something like a headache or blurry vision, that's more like very urgent that we address, because that can be associated with something called giant cell arteritis, or GCA, and we want to really treat that fast. That's not really technically an arthritis, but we associate it with the joints. It's actually a bursitis, where the sort of cushion, areas of cushion or fluid around the joints that sort of align the muscles so they don't stick together. That's called a bursa. Those get very inflamed. And so you literally don't have enough room to like move or maneuver, because there's like a water balloon sitting in there basically. So, but that's very sudden, typically sudden onset. So anything that happens like very fast is concerning. And then of course, if you fall and you think you broke something, right, that's something really to be seen for. Or if you dislocate a joint. So hypermobility or Ehlers-Danlos syndrome, or like some syndromes where you're very flexible and dislocate a joint, that's urgent. So yeah, those are the most like common, like fast acting things.
Okay. So we talked about red flags. We talked about the basics, a little crank of the neck, it's like a little funny. That's a little soreness, but the hot, the red, fever, headaches, sudden onset joint pain, maybe increasing very high intensity. Make sure you talk to your doctor. So you want to see if your joints are speaking that there's something much more serious on the line.
Mm-hmm.
Now, Doc, my next question to you is going to be, would you say you notice a difference between, like how do joint issues differ between someone who is active and someone whose job is more sedentary? So those who are more, on their feet versus those who tend to be seated most of the time. Would you say you notice a difference in your evaluation of patients?
Yes. So active patients or people, this is my clinical opinion, tend to minimize their symptoms. They tend to say, well, I feel better when I exercise, and I feel like the pain and stiffness goes away or gets better. And so they kind of kick the can down the road, so to speak. They sort of wait, and it's really easy to justify things like, well, I'm active, like I'm busy and I forget about it. And then when I'm sitting and still, the pain is there. Mm-hmm. So it's also important not to minimize something that's like affecting your ability to do something. So in Arizona, pickleball is really popular. I think across the nation, pickleball is popular. But I have patients with rheumatoid arthritis who play pickleball and do fine. And then I have other patients who were very active and their arthritis progressed, and then they slowly or quickly stopped being as active. So if you are somebody who is used to a high level of activity and that changes for you, that's a big deal. Or if you're somebody who can justify, I don't want to be on medication because I am able to be so active, that's not wrong. But we also want to make sure that the inflammation is being controlled, because we don't want it to progress to permanent damage. So autoimmune joint issues can lead to permanent, irreversible damage if we let it progress.
Okay.
So you don't really want to modify your behavior, right? If you're gripping a racket, you don't want to tape it so thick that it's easier to grip and say, oh, I'm fine, right? That meant something, that you had to modify your behavior. Or if you're a golfer and you want to play Saturday and Sunday and you can barely get through 9 holes one day a week, that's really slowing you down. It's not so easy to justify that you're fine, right? Something happened. The other thing that we see sometimes with active patients is they're busy during the day, and then when they sit and rest at night or go to bed and wake up, they get this sort of stiff feeling. And if that stiffness lasts for hours or longer, traditionally longer than 30 minutes, meaning, I was at a movie theater, right? And I reclined and I'm sitting watching a movie, and I get up and it's like, oh, I need to like kind of wiggle my body into waking up. That's fine, right? But if you are like, nope, I got to sit here a while because I know it's going to be painful for me to get going, or you're dreading your next thing that you have to do because it's very uncomfortable to go on to that next thing, that's not quite normal. So in the morning, typically, if it takes longer than an hour for you to like wake your body up, that's again kind of a red flag sign. If you're primarily a sitting person and you sit a lot, you will probably feel more stiff when you try to get up and do things, particularly in your knees and your hips and your back and your neck, because you're not really lubricating those joints and moving your fluid around and, getting your body going. So one of my favorite tricks for somebody like that, if you're like, well, I just feel kind of stiff all day, force yourself to drink water, because then you got to go to the bathroom. So when you get up and you got to go to the bathroom and you got to you probably got to position yourself, right? So you're taking a little stretch break, and it's really easy in the bathroom to do a couple
I like that.
Stretch your arms out, stretch your neck out, right? Like that's an excuse to like shake it out. In school, I have young kids. So in school, they have like jiggly breaks, right? They like get their jitters out and they, sort of jazz around for a minute or two, and then they can focus. We are exactly the same. We got to like loosen up our body and move our body around, and then we can kind of go back to focusing. And that's a really good brain exercise too, because you need a little bit of a separation from like a sitting there. And when we're like hunched over on our keyboards, that's very painful all day long to do that. So really reminding yourself to take a break and stretch your shoulders and like actually like, if again, going back to the body is water, if you put water in a freezer, it's going to solidify, right? We all know that.
Right.
If you make your body stay still when it's cold, you're going to tense up and tighten up. That's what water does. So when we're cold, like an air-conditioned office building or an air-conditioned house, and we're forcing ourselves to sort of do something and stay in a tight little area, the water in our body, in our joints, is going to tighten up. So when we kind of warm things back up again and take a stretch break and move around, right? Think of yourself as that sort of swishy water. That's your joints need that. And so that helps.
All right. Wow. We got 8 minutes more. But I wanted to ask this question. What role does our food play? We talked about water, so hydration is good, and getting up to go to the bathroom, so you're forced to move. I think adults need wiggly time too. But what role does food? I don't like call it diet, but what role does food play in how our joints speak to us?
Yes. So high sugar, high processed food, like packaged, like I think of wheat thins, right? We all know they're supposed to be made of wheat, but they're chemically made, right? Like what is a cracker? It's like a chemical compound of something. So chemically, really chemical foods are kind of irritating for our body. They can create inflammation. Our GI system doesn't quite know how to digest those chemicals. And so it sort of turns it into these inflammatory signals. And so does a lot of sugar and fructose corn syrup. And even artificial sweeteners are chemicals. So we think we're doing a good job by 0-calorie sweetener. It's a chemical. And so our body gets really confused about what that means. And it starts triggering very low, subtle levels of inflammation. And when we do that over and over and over and over again, it escalates that inflammation. So one of the biggest triggers for arthritis patients with autoimmune diseases is a lot of sugar, carbohydrate type foods that can make your psoriasis flare or make certain types of rashes flare. It can make your joint pain flare. So I really tell my patients, be aware of the way that food makes you feel. If you eat something and then you're like, oh, I don't really know that sat well with me, that's a sign that your body is not really enjoying digesting that. Versus, let's say you have an apple and some nut butter, you get a little perk of energy and you like go on with your day, right? It's usually something that you're kind of like, oh, I feel better from that. So pay attention to what your body's really feeling like, because that's our way of talking, you know, our body's way of talking to us, and see, do I feel bloated? Do I feel gassy? Do I feel like this gives me a lot of heartburn? Am I burping a lot after this? Am I feeling like, man, I got to rush home, you know, after I ate that lunch sort of feeling? Those are signs that your body's not quite loving what you put in it.
You know what's so interesting? And I see this over the new year. You know, people go on different, you know, fasts or diet. There's one, the Daniel's fast, that's usually following the Daniel fast and the Bible, where he decided no meat. He just ate, you know, plant-based. And my patients feel great. They
Yes.
come back, oh, my joint. They told me I need a new hip. I'm feeling better. And I'm like, man, this is awesome. And I'm like, can you continue this change? They're like, oh, heck no. I love meat. So that being said, because we want to keep it practical, you know, easy, like how do you encourage your clients to take on more good quality foods without feeling like they're depriving themselves of all the things, especially when we see that your joints say, hey, I approve of this cleaner foods?
Yeah. I think you have to just have that moment where you sit with yourself and say, is it worth it that I feel this way when I do this? And, you know, evaluate too, do I have an underlying issue with that kind of thing, right? If it's meat, do I maybe actually have gout and the meat is showing me that I'm not controlled? And so, you know, do I have a sensitivity to gluten? I might not have celiac, but I might not like gluten. So if you are somebody who says, I just want to put that in my body and I will deal with the consequences, that's up to you. But if you truly feel better eating a certain way, eating plant-based, eating less meat, eating less red meat, eating less sugar or soda, again, that's one of those things where you're kind of like, okay, I have to make a decision here. It's sort of like buying a car. Do I spend all of what I have on something super fancy because I have to have it? Or do I budget and this is what I can have right now? And I'm doing okay. I enjoy driving this car, but maybe someday I would want something else, right? We all make decisions where we have to pick one or the other. And the food that we eat is the same way. We just have kind of grown accustomed to being able to have access to everything all the time. Anybody can go to McDonald's at any time of day and get a cheeseburger. But that doesn't mean that cheeseburger is good for you. It means you made a decision and you then will feel a certain way after you eat that meal. So if you feel better when you eat clean and plant-based and what I consider food that you recognize, right? I know this is an apple. I know this is lettuce. I know this is a mushroom. Then, and you think you have more mental clarity, you have less pain, that is better than paying for 4 prescriptions to dull down those symptoms you feel from eating not so great food. But it's the way we tell ourselves what that means, right? If I want to feel better, it may mean I have to drive this kind of car. I have to do this thing for myself in this part of my life. And maybe I can have a few of those other things every once in a while, but I'm not going to be that person anymore. And so we just kind of have to come to terms. You know, I'm somebody who I love to be on time. I love, love, love to be on time, but I run late and I just have to be okay with that. Or I have to take things off my plate, right? And so I show up to my kids' practices late. We show up to certain events late. We show up to family dinner late. But I make that decision and I have to be okay with that, or I have to decide, okay, I'm not going to do this extra load of laundry before going to family dinner. We're going to end now and go and be on time, right? All those little decisions we make all day, every day, make us who we are. So we have to just decide, who do we want to be? And it's hard. It's such a hard decision. But when you have family to support you, when you enlist a team or a coach, or you have a great healthcare doctor on your side cheering you on, then those decisions are a little bit easier. But if we do it alone, that doesn't feel so good. So, you know, if you're somebody who loves how you feel when you eat healthy and clean, get somebody else to be with you on that journey and do it together.
I love that. Get a team. You know, it was so interesting. I was talking to someone earlier, maybe last week, and I said, I pray that the systems that keep you doing the things that you're able to do stay in place. And those systems are support systems, things that make it easier to make better decisions. So someone who will give you a fruit and vegetable with every meal, someone who will encourage you and say, hey, have you had your 8 bottles through a text? So get those systems. Our joints are talking and we need to listen. Dr. Panico has been amazing. I have a very good question here. Hi, Miss Pat. Thank you for joining. I got to give a shout out to Miss Pat. All right. She says, aren't low calorie, no calorie sweeteners like honey, monk fruit, and stevia okay? And would not be lumped in with the chemical sweeteners like saccharin and Splenda?
That's a good question. It depends. It depends. So honey can be pure honey, right? Or it can be combined with other chemicals and modified and refined. So if you see a list of ingredients and you're like, I can read that word, that's something in my language that I know what that means, then it's real. So monk fruit is a real thing, right? Mm-hmm. But if you read chemically hyphenated, a lot of consonants and not as many vowel things, and you're like, how do I pronounce this? That is probably a chemical or some kind of modified, right? High fructose corn syrup is words. Mm-hmm. But what is that? Can anybody actually, like, can you imagine what high fructose corn syrup is? It's a liquid, but we don't really understand how it gets to be that way. It has to be chemically processed and modified.
Yes.
So if there's something, right, we know how honey is made from bees and harvested. So if you can think of something tangible where you're like, I envision this coming from a plant or coming from an animal or, bees, then I would steer in that direction, like agave, right? That comes from a plant. Mm-hmm. We can tangibly identify what that is. And then also it's moderation, right? So the chemical sugars trigger a lot more dopamine in our brain to say, give me more, give me more, give me more. And so if you're drinking or ingesting a chemical, your feel-good hormone is going to say, I need more, I need more. Whereas if you use something like honey, right, you're kind of like, okay, that was enough. Like that was a little too sweet, right? Or like, I'm satisfied with that. You have a much more natural sort of on and off switch.
Yes. Powerful. And stevia is plant-based too. And, there was a rave about the artificial sweeteners being a thing, but it actually drives the desire for more dopamine hits. So it feeds the desires for more sweet. So it's like shooting one's foot. So I wouldn't do the artificial. So yes, the monk fruit, stevia, honey, in moderation, like Dr. Panico has said. Very good question, Ms. Pat. Thank you so much. Brittany, we're past time. Doc, we're past time. So I have people who are watching who are like, man, this doctor knows a lot of stuff, uses a lot of big words, and she breaks it down in ways that we can understand. Where can people find you, follow you, get more information, read about some of the things you do, Doc?
So I am at Dr. Brittany Panico. So my name, like you see on the screen, but doctor in front on Facebook. I think we linked it to some of these posts as well. If you log into my Facebook or see the Brittany Panico Facebook, I have a link on that as well for my doctoring stuff. And then Summit Rheumatology, all of my team members, I have a wonderful team in Arizona, Colorado, Oklahoma, Washington, West Virginia. They are all accepting new patients. And so you can find us on our website at summitrheumatology.com. And then I am just floating around always everywhere. So you might see my name pop up if you Google me. There's lots of stuff. I have a YouTube. I have some articles about arthritis. So yeah, all those things are fair game.
Hey, Doc, you have a YouTube channel? What's the name of your YouTube channel? I didn't get that here.
It's Dr. Brittany Panico as well. It should be searchable on YouTube. Yeah.
All right.
I'm on TikTok, sort of. You might be able to find me on TikTok.
All right, she's a TikToker.
I try.
All right, you can find it all over. I'm putting it at the bottom of the screen. For those of you watching, be encouraged. Your joints are talking. Listen to the cues they give you. Implement the things that help make your joints move and sound better. And can we give Dr. Panico a shout out? Can we thank her for that?
You.
I
Thank you
appreciate
all.
you.
Yes, thank you.
Thank you, thank you, thank you. Thank you, Miss Pat. Thank you, Dr. Mona, Berna, Miss Adefuluke. I appreciate you. And Dr. Una, thank you so much for stopping by. And Dr. Funke. And for all those who are watching who I didn't mention, I'm giving you virtual high fives. I appreciate you engaging in conversations that help move you forward, joint-wise and otherwise. As always, well, before I wrap up, Dr. Panico, I really appreciate you. I know you're busy, so thank you for stopping by.
Thank you. This was fun. And I'll come back anytime you want.
Okay, I got that on record. So good. So that's good. Thank you all for watching. As always, if you or anyone you know is looking for a thorough, a compassionate, and caring family physicians that will have conversations like this to help you live longer well, I am she. And if you're looking for an awesome rheumatological team in the Oklahoma and area she mentioned, she. Thank you all for watching. Have a good one. This was good. This was